Hello friends, today I am going to continue our topic on fibrous tumor. So today we will discuss on fibromatosis. L- Let's move forward. So in fibromatosis we have two types. One is superficial fibromatosis and other deep. Superficial fibromatosis is an infiltrative fibroblastic proliferation that can cause local deformity but has an innocuous that is mean by harmless clinical force. Mm, that means superficial fibromatosis cause local deformity, but it is usually harmless. All forms of superficial fibromatosis affect male more frequently than female. They are characterized by nodular or poorly defined broad fascicles of fibroblast in a long sweeping fascicles surrounded by abundant dense collagen. Several clinical subtypes have been identified. Let's discuss type. That means let's um, Palmer Dupuytren contracture: irregular or nodular thickening of the palmar fascia, either unilaterally or bilaterally, over a span of hair. Attachment to the overlying skin causes puckering and dimpling. At the same time, a slowly progressive flexion contracture develops that mainly affect the fourth and fifth finger of hand. Let's see figure. You can see in fourth and fifth. You can see here in fourth and fifth finger. The flexion, slowly progressive flexion contracture is being developed in fourth and fifth finger of hand. And it causes overlying skin puckering and dimpling of overlying skin. You can, it's not so clear. What also? Now let's move towards Lederhouse disease, second type. In Lederhouse disease or plantar fibromatosis. Plantar fibromatosis is known as Lederhouse disease. It is mentioned in 10th edition update. Later-house disease or plantar fibromatosis occur in boys from under 10 years of age to into adolescence. It is unilateral and does not cause contracture but can be associated with palmar and penile fibromatosis. So you can see figure, plantar fibromatosis. It is unilateral, whereas palmar can be either unilaterally or bilaterally. And contracture develop in palmar, but no contracture develops in plantar. Now third type, penile or Peyronie's disease. Peyronie disease. Penile. Palpable, palpable induration or mass on the dorsolateral aspect of the penis. Eventually, it may cause abnormal curvature of the shaft, constriction of urethra, or both. You can see here. Fibrous plaque on corpus restricts symmetrical erection, acts like a tether, causing curvature. In about 20% to 25% of cases, the palmar and plantar fibromatosis stabilize and do not progress, in some instances resolving spontaneously. Some recur after excision, particularly the plantar variant. Now, let's move to the second type of fibrous tumor, deep fibromatosis or desmoid tumor. Deep fibromatosis are large infiltrative masses that frequently recur but do not metastasize. They are most frequent in teens to 30s, predominantly in women. In superficial, it was more common in men. Here, it is predominantly in women. Abno- Abdominal fibromatosis generally arise in the musculoaponeurotic structure of the anterior abdominal wall, but tumor can arise in limb girdle or mesentery too. So, abdominal fibromatosis generally arise in musculoaponeurotic structure in anterior abdominal wall. Deep fibromatosis contains mutation in APC or beta-catenin gene, both of which lead to increased WNT signaling. The majority of tumors are sporadic, but individuals with familial adenomatosis adenomatous polyposis, Gardner syndrome, who have germline APC mutation are predisposed to deep fibromatosis in some individual. The majority are sporadic; they are not familial. But familial in APC, in Gardner syndrome, there can be they are predisposed to deep fibromatosis. Morphology: fibromatosis are gray-white, firm, poorly demarcated masses varying from 1 to 15 centimeter in greatest diameter. They are rubbery and tough and have marked infiltration of surrounding muscle, nerve, and fat. They have marked infiltration of surrounding muscle, nerve, and fat. We will see in figure. Cytologically bland fibroblasts arranged in broad sweeping fascicle amide in the middle of dense collagen are the characteristic histological pattern. See again, cytologically bland, that is soft contour. Fibroblasts arranged in a broad sweeping fascicle in the middle of dense collagen are the characteristic histologic pattern. The histology resembles scar. You can see here fibromatosis infiltrating between skeletal muscle cell. This is skeletal muscle, and all fibromatosis are infiltrating around skeletal muscle. They are spindle shaped cell in the mid of collagen or dense collagen fiber. Clinical feature: in addition to possibly being disfiguring or disabling, deep-seated fibromatosis is occasionally painful. Because of the extensively infiltrative nature, complete excision is often difficult. In ninth edition, they have mentioned treatment. Recent efforts have concentrated on medical therapy with cyclooxygenate 2 inhibitor, tyrosine kinase inhibitor, or hormonal blockade tamoxifen. In 10th edition, they have mentioned that they have effort have been concentrated on medical or radiation therapy as alternative to surgery. The treatment guideline may have been changed recently. So you can remember those 10th edition. Recent effort have been concentrated on medical or radiation therapy as alternative to surgery. Thank you.